Imagine getting a deep cut thousands of years ago. No hospital, no pharmacy, no clean bandages sealed in plastic, and definitely no doctor waiting nearby with antibiotics. You've got a wound, some basic tools, and a serious problem. Because the bleeding might not kill you, but what happens next could. Dirt gets inside, the wound swells, a fever begins, and days after surviving the original accident, your body starts losing a battle against an enemy nobody can even see. So, how did ancient humans survive any of this? Were they simply tougher than us? Did they get lucky? Or did they understand more about medicine than we usually give them credit for? The answer is surprisingly complicated. Ancient people didn't know about bacteria. They couldn't see microscopic organisms, and they had no scientific explanation for infection. But they weren't blind. They noticed patterns. They saw that some wounds healed while others became red, swollen, and deadly. They learned that certain materials slowed bleeding, some plants reduced pain, and some treatments seemed to keep a wound from getting worse. They didn't understand the invisible process. They understood the result. And over countless generations, those observations became a survival system. Not modern medicine, but not random guessing either. The first challenge was obvious. Stop the bleeding. A serious injury can become fatal within minutes. So before ancient healers could worry about fever or infection, they had to keep the injured person alive. Pressure was probably the simplest solution. Press something against the wound, hold it there, and give the blood time to clot. It sounds basic, but basic doesn't mean useless. Direct pressure is still one of the first things we use to control external bleeding today. Ancient people worked with whatever they could find. Soft plant fibers, clean-looking leaves, pieces of hide, bark, moss, cloth, once woven materials became available. Some communities also learned that specific plants seemed better at controlling bleeding than others. Yarrow became especially famous. It was used in different regions as a treatment for cuts and injuries, and its scientific name, Achillea millefolium, connects it to the legend of Achilles treating wounded soldiers. Did every plant treatment work? Absolutely not. Some probably did nothing. Others may have made the situation worse. But when a useful treatment improved someone's chances of survival, people remembered it. And that knowledge mattered. Because ancient medicine wasn't reinvented every time someone got hurt. Information could be passed from an experienced healer to a younger apprentice. Which plant to collect, which part to use, how to prepare it, how much to apply, and, just as importantly, which plants to avoid. That's not formal medical school, but it is medical education. Then there was one of the most useful wound treatments in the ancient world, honey. Yes, the same sticky substance sitting in your kitchen. Honey appears in several old medical traditions as something placed directly on wounds. And unlike many historical treatments, this one has real value. Honey makes it difficult for many microbes to grow. It also helps maintain a wound environment that can support healing. Modern medicine even uses specially prepared medical-grade honey in certain situations. Ancient healers didn't know the chemistry. They didn't need to. If one wound was covered with honey and healed well, while another became badly infected, that difference was worth remembering. Repeat that observation across generations, and you get a treatment tradition. That's the fascinating part. These people were fighting a microscopic enemy without knowing that enemy existed. Cleaning the wound was another major step. When dirt, splinters, or damaged material remained inside an injury, the outcome was often worse. So wounds were washed, wiped, or flushed using whatever liquids were available. Clean water was the obvious choice when people had access to it. Other cultures used wine or vinegar in certain preparations. Those substances weren't perfect antiseptics, but their chemistry could sometimes make conditions less friendly to microbial growth. Of course, ancient wound cleaning was inconsistent. A liquid might look clean and still contain dangerous organisms. A healer's hands or tools could contaminate the injury again. And without germ theory, people couldn't understand why a treatment that worked once might fail the next time. They could observe the pattern. They couldn't control every variable. Still, cleaning a wound and covering it afterward was usually better than leaving it packed with dirt and exposed to insects. Ancient wound coverings came in many forms: leaves, linen, animal material, plant fibers, resins, and other locally available substances. The goal wasn't always explained in modern terms, but the logic was recognizable. Protect the damaged area, hold the treatment in place, and give the body time to repair itself. But cuts were only the beginning. What happened when someone suffered an injury so severe that part of the body couldn't be saved? This is where the story gets uncomfortable. Ancient humans performed surgery. And we're not only talking about the famous physicians of Greece, Rome, India, or Egypt. Evidence of complex medical intervention reaches much further back. On the island of Borneo, researchers discovered the remains of a person whose lower leg had been deliberately removed at least 31,000 years ago. This wasn't an animal attack. The bone showed signs consistent with a controlled amputation followed by healing. The individual survived and continued living for years. Think about what that required. Someone had to make the decision to remove the limb. Someone needed a sharp tool and enough anatomical knowledge to avoid immediately killing the patient. The bleeding had to be controlled. The wound had to remain manageable during recovery. And then came the hardest part. The patient needed long-term care. Food had to be brought to them. They needed protection. They may have required help moving, cleaning the wound, and surviving day after day while their body healed. The operation was only one moment. The community made survival possible. Another dramatic ancient procedure was trepanation, creating an opening in the skull by cutting, drilling, or scraping away bone. That sounds horrifying, and honestly, it probably was. But healed skulls show that many patients survived. Why was it done? There probably wasn't one universal reason. In some cases, it may have been connected to head trauma. Removing a piece of bone could potentially relieve pressure after an injury. In other cases, the purpose may have been spiritual or ritual. Ancient cultures didn't always separate physical illness, the mind, and the supernatural the way modern medicine does. Whatever the reason, this wasn't a careless procedure. It required patience, control, and practice. And then there's the obvious question. How do you cut into someone's body without modern anesthesia? Very painfully. Still, ancient people had access to substances that could reduce pain, cause sedation, or alter consciousness. Willow bark was used in several traditions to treat pain and fever. It contains compounds related to the chemistry that eventually gave us aspirin. Opium was known in parts of the ancient world. Alcohol could dull pain and awareness. Plants such as mandrake contained powerful chemicals capable of producing sedation, although getting the dose wrong could be extremely dangerous. These weren't safe, standardized medications. One plant could be stronger than another. Preparations varied, and the difference between a useful dose and a deadly one wasn't always clear, but the intention mattered. Ancient healers recognized pain as a problem they could try to manage. Not every treatment was clever, though. Some were brutal. Cauterization involved burning a wound with heated material to control severe bleeding. In an emergency, it could help close damaged blood vessels, but it also destroyed healthy tissue, caused extreme pain, and created additional trauma. Other treatments relied on contaminated materials or plants with toxic effects. Spiritual explanations could lead to procedures that offered no physical benefit at all. Ancient medicine was never a collection of hidden miracle cures. It was a mixture: useful observations, cultural beliefs, desperate experiments, accidental discoveries, and mistakes that sometimes lasted for generations. But the successful parts reveal something important about human intelligence. You don't need a microscope to notice that one treatment performs better than another. You don't need to understand chemistry to learn that a certain bark reduces pain. And you don't need germ theory to realize that a washed and covered wound often does better than one filled with dirt. Ancient healers worked backward from results. When something helped, they remembered it. When it failed, they tried something else. And when written medical texts finally appeared, they didn't look like humanity was beginning from zero. Some contained organized cases, symptoms, examinations, treatments, and expected outcomes. That suggests written medicine was recording knowledge that people had already been developing and sharing for a very long time. But perhaps the most important ancient treatment wasn't a plant, a bandage, or a surgical tool. It was care. A badly injured hunter couldn't collect food. Someone recovering from surgery couldn't defend themselves. A person with a broken leg might need weeks or months of support. Survival depended on other people choosing to help. They carried the injured, shared food with them, protected them, cleaned their wounds, and stayed beside them through long recoveries. Without that support, even the best treatment available might have been useless. So the history of ancient wound care isn't really a story about primitive humans stumbling around in the dark. It's a story about observation, memory, experimentation, and cooperation. Our ancestors couldn't see bacteria, but they could see what bacteria did. They didn't understand the chemistry inside medicinal plants, but they could recognize when pain decreased or healing improved. They lacked modern equipment. They lacked antibiotics. They lacked the scientific language we now use to explain the human body, but they didn't lack intelligence. And when one of them was wounded, they often didn't leave that person behind. They treated them. They protected them. They kept them alive. And somewhere in that long chain of injured people who survived because others refused to give up on them were your ancestors, which means their knowledge didn't just heal the past. In a very real way, it helped create you.